Did you know that 1 in 3 adults worldwide suffer from hypertension? Yet many people don't even know they have it. Often called the silent killer. Hypertension can lead to severe health problems if it left unchecked. Today we are going to explore what hypertension is, how it affects your body, and what you can do to manage or prevent it. Hello, science enthusiasts. Welcome back to SWA. I am Ayub Basiri, and today we are diving into important and often misunderstood topics hypertension. Whether you are here to learn more for yourself or loved one, or just out of curiosity, this video will give you a comprehensive understanding of this common condition. Hypertension or high blood pressure has been recognized as a medical condition for centuries, but our understanding of it has evolved significantly over time. The concept of blood pressure dates back to the 17th century when an English physician named William Harvey first described the circulation of blood in human body. However, it wasn't until 19th century that doctors began to measure the blood pressure using devices like a sphygmomanometer, which was invented Samuel Siegfried Karl von Bach in 1881, if I pronounced his name right. Early measurements of blood pressure were primarily used to understand the mechanism of the cardiovascular system. But over time, it's become clear that elevated blood pressure was linked to a range of health problems. The term hypertension was coined in the early 20th century, and by the mid 19th, it was recognized as major risk factor for heart disease and stroke. Despite its long history, hypertension remains a significant public health issue today, affecting millions of people around the world. What actually is hypertension? In simple terms, hypertension is when the force of blood against the wall of your arteries is consistently too high. Your blood pressure is determined by two factors: the amount of blood your heart pumps and the resistance to blood flow in your arteries. When your arteries are narrow or stiff, the heart has to work harder to pump blood, leading to higher blood pressure. Blood pressure typically measured in millimeters of mercury and is expressed as two numbers: systolic pressure over the diastolic pressure. The systolic pressure is the factor when your heart beats, while the diastolic pressure is the force when your heart is at the rest between beats. A normal blood pressure reading is around 120 over 80 millimeter of mercury. Hypertension is generally diagnosed when your blood pressure consistently reads 140 over 90 millimeter of mercury or higher. However, it's important to note that blood pressure can vary through the day due to factors like stress, physical activity, and even the time of day, which is why multiple readings are often taken to confirm a diagnosis. There are two types of hypertension: primarily or essential hypertension and secondary hypertension. Primary hypertension is the most common form and develops gradually over many years due to factors like genetic, diet, and lifestyle. Secondary hypertension, on the other hand, is caused by an underlying condition such as kidney disease, hormonal disorder, or certain medication. In these cases, treating the underlying condition often resolves the high blood pressure. The discovery and understanding of hypertension have been gradual process. As mentioned earlier, the invention of the sphygmomanometer was a key development in measuring blood pressure, but it was the work of early 20th century physicians that really brought hypertension into the focus as a medical condition. One of the most significant breakthroughs come from Frederick Akbar Muhammad, an English physician who in the late 18th conducted pioneering research on blood pressure. Muhammad was among the first to recognize that high blood pressure could exist without any apparent symptom, which led to the idea of silent hypertension. In 1930s, the link between high blood pressure and heart disease became clearer thanks to the studies conducted by American cardiologist Paul Dudley White. His work showed that hypertension was a major risk factor for heart attack and stroke. This research laid the foundation for the Birmingham Heart Studies, which began in 1948 and provided extensive data on the risks associated with hypertension. By the mid 20th century, hypertension was widely recognized as a major public health issue. The introduction of antihypertensive drugs in 1950s, such as diuretic, marked a significant advance in the treatment of high blood pressure, and research into its cause and treatment has continued to this day. Understanding hypertension is crucial not just for preventing and managing the condition, but also for its implication in other areas of health. For example, blood pressure management is a key component in treating conditions like heart disease, stroke, and kidney disease. In the medical field, blood pressure readings are an essential part of routine checkup, helping the doctor monitor cardiovascular health and assess the risk of developing related conditions. Hypertension is also closely monitored in patients with diabetes, as the combination of high blood pressure and diabetes significantly increase the risk of complications. In terms of public health, widespread screening for hypertension is a crucial strategy for reducing the incidence of heart disease and stroke. Many countries have implemented programs to encourage regular blood pressure monitoring, especially among population at higher risk. Hypertension management also has a significant impact on healthcare costs. By controlling blood pressure through life change and medication, we can reduce the incidence of heart attack, stroke, and other complications, ultimately lowering the burden on healthcare system. Let's dive deeper into the mechanism behind hypertension and some of last research in the field. One of the most interesting aspects of hypertension is how it's related to the autonomic nerve system, which controls involuntarily body function like heart rate and blood pressure. The automatic nerve system has two main branches: the sympathetic nerve system, which prepares the body for the action, and the parasympathetic nerve system, which calms the body down. In people with hypertension, these are often an overactivity of the sympathetic nerve system, leading to increased heart rate and blood vessel constriction, which raises blood pressure. Recent research has also shed light on the role of kidneys in hypertension. The kidneys regulate blood pressure by controlling the volume of blood in the body. They do this by adjusting the amount of sodium and water extracted in urine. However, in some people, the kidneys may retain too much sodium, leading to an increase in blood volume and consequently higher blood pressure. Genetics also play a significant role in hypertension. Studies have identified several genetic variations that increase the risk of developing high blood pressure. These genetic factors can affect how the body regulates body pressure, how the kidney handles sodium, and how body vessels are functioning. Additionally, there is growing evidence that hypertension is linked to inflammation and oxidative stress, which can damage blood vessels and lead to atherosclerosis, a condition where arteries become clogged with fatty deposits. This, in turn, increases the risk of heart disease and stroke. In terms of treatment, the management of hypertension has advanced significantly. Antihypertensive medication now target various pathways involved in blood pressure regulation, including beta blockers, ACE inhibitor, calcium channel blocker, and antagonist 2 receptor blockers. These drugs help lowering the blood pressure by relaxing blood vessels, reducing heart rate, or decreasing the volume of blood. Lifestyle interventions are also crucial. Regular physical activity, a diet low in sodium and high in fruits and vegetables such as DASH diet, maintaining a healthy weight, and avoiding tobacco and excessive alcohol use can all help manage and prevent hypertension. In summary, hypertension is a complex condition with far-reaching implications for health. It's often called the silent killer because it can go unnoticed for years while quietly damaging your heart, blood vessels, and kidneys. But the good news is that hypertension is both preventable and manageable. By understanding your risk factor, making lifestyle change, and working with your healthcare provider, you can take control of your blood pressure and reduce your risk of serious health problems. If you found this video helpful and want to learn more about managing hypertension or other health related topics, leave a comment below with your question or video suggestion. Your input helps shape the content of this channel, and don't forget to like, share, subscribe to SWA for more in-depth science and health videos. Until next time, stay curious, take care of your health, and keep exploring the wonders of science.